My name's Jim Striedelmeyer. I'm part of Neighborhood Fellowship, part of the church that hosts the IU Student Outreach Clinic, and we want to invite faculty and students come. This clinic makes a difference in our community and has for the last 8 or so years. We've been so thankful. We've taken people for years to the emergency room, and instead of doing that, the clinic has provided a place where we could advocate for our friends and our neighbors, bring them in so that they can get some appropriate care, and then send them out healthy, joyful. So we want to invite everyone who's connected to IU, particularly in medicine, law, dentistry. We want you to come and be part of this clinic and make a difference.
Welcome to the IU Student Outreach Clinic. I'm Alex Simonton and I serve as one of the co-clinic managers. Thank you for volunteering today. We are so excited that you're here to share your skills and make a meaningful impact on the community. The IU Student Outreach Clinic is a nonprofit, student-run clinic dedicated to providing free medical care and other services to the underserved and uninsured population of Indiana. We are able to fulfill this mission through the hard work and dedication of students and faculty, as well as the generosity of our supporters. We are so proud to have representation from 10 different partners who help to make the clinic a success. In order to maximize collaboration and ensure best possible health outcomes, it's important for volunteers to know about each partner's specific role. As you'll see from the partner interviews and the corresponding knowledge tool, students from dentistry, law, medicine, nursing, occupational therapy, pharmacy, physical therapy, social work, and Timmy Global Health have joined efforts to provide comprehensive care to patients.
Hi, I'm Ben Fisher. I'm the chair of the IU Dental School Student Outreach Clinic.
I'm Jay Vahitheron. I'm vice chair.
And we are 2 members of our 19-member executive board here. We operate generally the first and third Saturday of every month out of People's Health Center on East 10th Street. And we see typically anywhere from 12 to 20 patients each session. We operate from 10 a.m. to 2 p.m. And we have a wonderful group of student volunteers that assist us in this.
And the type of care that we provide includes non-emergent care, including fillings, extractions to address any pain, as well as oral cancer screenings, radiographs, and general cleanings and checkups. How our clinic operates is our first and second year dental students assist the third and fourth year students with charting, and the third and fourth year students are the ones who provide the care in the clinic.
And I'm here with the legal clinic, and so the volunteers here are law students. Because we're law students, we cannot give legal advice. We work with Indiana Legal Services, so usually there is an attorney here who can do more so of the advice. As students, we can explain basic legal principles. We can refer you to services that can help with any issues that come up. And we can connect you with some other resources that may be able to help. So in a regular day, we come in, set up, there's usually 2 or 3 law students here and a volunteer attorney. And we just see clients, talk through their issues, and then refer them. And that's what we do in the legal clinic.
Hey, this is Rana Patnaik, and I am the chair-elect of the Student Outreach Clinic, the medical team. We provide point-of-care services for patients, and we lead them through the clinic. So the MS1s, MS2s take their history, and then they hand it off to the MS3s, MS4s, who take their physical and make an assessment and plan along with the MS1s, MS2s. They then present to the attending, and so it's an educational process for students, but also provides primary care to patients. We also focus on things such as women's health care, vision at different times of the year. We also work with our partners, nursing, PT, OT, law, dentistry, and social work to provide comprehensive care for our patients, and over time, the hope is that they'll follow up with us here or with the primary care physician that we connect them with elsewhere.
nursing here at the Indiana University Student Outreach Clinic. And I'm just going to talk about some of the key things that we do as nurses here. The main thing we do in the morning is we pair with PT and OT, so physical therapy and occupational therapy, to do screenings with our patients. With this, we like to see what referrals need to be made and how to best care for the patients as they're here to give them everything that they need. We also, throughout the day, we have nurse navigators who work with the patients to take notes for them, give them all the education needs that they have, and make sure to take them to all the partners that they need to go to. As we do that as navigators and as screeners, we kind of become like care coordinators to make sure that they get everywhere that they need to go and they have all the information they need to be successful every week that they keep coming back. And the last thing that we do is we're really big educators, so we like to use the health coaching strategies with our patients and really make sure that we sit down with our patients and go through the education materials and just make sure that they really understand their care. So that's pretty much what we do.
Liebarger. With me today, I have two first-year students.
My name is Andrew.
And my name is Jonathan.
And I'm the chair of the occupational therapy cohort at the Student Outreach Clinic. With occupational therapy, we try promoting patients to get back to their meaningful everyday activities that are most important to them. So first years, we try and get them to work with nursing and physical therapy, and we promote like a trio that works on the screening tool to promote interprofessional collaboration here at the clinic. With second years, we try and primarily get them to working with some interventions with the patients. So some interventions that we might work with as occupational therapy, we do a lot of stress management for anxiety and depression. We do medication management, and we also are here to fabricate orthoses for patients maybe with carpal tunnel syndrome, some diagnoses like that. Another way that we try and promote interprofessional collaboration here at the clinic is we work on the smoking cessation program with pharmacy.
I'm one of the medication therapy consultants with BUCOP.
And my name is Connor Hummel, and I'm one of the clinic managers here at BUCOP.
So BUCOP just stands for Butler University Community Outreach Pharmacy, and it's really our entire operation that you can kind of see going on behind us here. It supplies all the pharmacy tasks, I guess, for the clinic. So we work with med to make sure that patients are receiving their proper care, getting refills if they need it, seeing medicine if they need refills or if they have something that we need medications for. We do blood pressure checks for all of our patients. We have a smoking cessation program, and we have a bridge to access program to sign our patients up for inhalers if they're getting year-round inhalers. We have 2 clinic managers every week and 1 MTC, which works back with med to make sure that our prescriptions are coming out and doing kind of a final verification from our end. And then we have a pharmacist who's on duty with us as well. And then the rest of our operation is run by volunteers, so students anywhere from our P1 year or junior year to our P3 year or the 5th year students. And they'll come back here, they'll do all the filling, all the counseling for our patients, and really just make sure our patients are taken care of from a pharmacy standpoint.
Here with the IU Physical Therapy SOC, and we are here, we screen patients with a nursing and an OT student each week. We are here 1 week out of the month, and our counterpart, India, is here 1 week a month as well. And so each Saturday we come in, screen patients who are experiencing pain, particularly in their muscles and joints, and we get them up here and work on exercises in the clinic as we would in the clinic once we get out of school. And we have a first year, a second year, and a third year who work as a cohesive team to really kind of delve into the problems that each patient is experiencing. Then we go back and talk to one of our professors, and we kind of all work together to make the patient feel better and alleviate that pain. Each patient is sent home with an exercise program that they can do at home, and whether they need crutches or a wheelchair, a walker, or TheraBands, those are gone home with the patient as well. So we really look forward to having you here in our clinic and working with us. It's a great opportunity to get your clinic skills and just really work with patients outside the community. So thanks. Hello, my name is Paige Clemmy. I am the social work chair here at the Student Outreach Clinic. So what does social work do? Well, we provide one-on-one consultations with clients to listen to what's going on in their lives, celebrate successes, as well as listen to issues that they might be having, and then providing resources for the needs that they do have. We also help them fill out applications if they need that, and on occasion we actually act as liaisons between the clients and community organizations. In times of crisis, we do have wonderful faculty that come in with us, and we do mental health screenings like suicide screens as well for crisis interventions. These are the main resources that we do provide, and we also follow up with clients who return to see how to see whether or not they were able to get the resources they needed, and if any other resources have popped up as well.
Hi, I'm Abby Hadley, and this is Timmy Global Health. We're the registration desk, so we're usually the first people that the patients come in contact with. They give us their name and their information, and we sign them up here. We also answer a lot of questions about what services are offered today, what's going on. Sometimes we have dentistry and we point them in the right direction. Sometimes they're just curious about the clinic and want to know what's going on. So we're usually the first line that patients come to, and we tell them a little bit about the clinic, where to go. We point them in social work if they need care or any other services we have. And we try to provide a friendly face for their first meeting and first impression with the clinic. Now that you've learned about the partners and their roles at the clinic, we'd like to explain interprofessional collaboration and what this might look like for you. According to the World Health Organization, interprofessional collaboration occurs when multiple health workers from different professional backgrounds work together with patients, families, and communities to deliver the highest quality of care.
Interprofessional collaboration should not take away from a discipline's ability to provide care or treatment. It ensures that the entire team is learning and performing in its highest potential. As an example, we have prepared a hypothetical scenario between two volunteers who are collaborating to provide comprehensive care to their patient. Hi Alex, I'm Lauren with OT, and we have a patient upstairs that we think would be good for you to see. So his name is Mr. Jones. He came to us from the dental clinic, and they referred him because of his high blood pressure. So he is treated here often for hypertension, and medicine kind of told me that he hasn't been doing well complying with his medications recently, and they're concerned because he's been drinking more since he recently lost his job, and now he might be separating from his wife and kind of going through that. So we brought him upstairs and did a screening for depression and anxiety. He did trigger for depression and is at risk for anxiety, but we also had talked about returning to work, and that sounds like that's something that he's interested in. So didn't know if you would be able to kind of help him more with that?
Yeah, absolutely. At social work we have a lot of different resources, and I'll sit down with him, talk about his interests, and help identify some potential jobs for him, and I'll help him with that process.
Okay,
We
great.
can also make sure he has transportation to and from the interview. We have bus passes that we like to give out, which is always nice for our patients. And then
Absolutely.
I would definitely suggest referring him to law, and they can give him some more education and walk through what that divorce process would look like. And then, of course, just sending him to pharmacy, making sure that he's getting his medications, and then hopefully they can talk through how to stay compliant.
Oh, great. Well, then I will go check in with pharmacy to make sure that they don't need to see him first, and if not, I'll send him your way.
Awesome, thank you.
Great. So just as a disclaimer, we'd like to let you know that this is just one representation of how collaboration can happen at the clinic, and by no means does this represent all situations or all necessary partners that should be involved in collaborating.
Please let us know if you have any questions throughout the day. We hope you have a fantastic volunteer experience. Thank you.